Hi, Catie here from Front Porch Nurse. We are still in our mini explainer series of perimenopause symptoms, and today is joint pain, body aches, and fatigue. You may be familiar with this one. Joint pain and fatigue are early perimenopause symptoms. They can get dismissed as just aging, or, oh, you probably have arthritis coming on, because they're often some of the first symptoms that we feel. And one of the things is if you notice that your joint pain is really sudden or widespread, like not just a few joints or a few fingers or toes, whatever, or maybe one hip, it's like all over all at once. And if it's harder to recover from that joint pain than it used to be, like maybe you used to pop a couple ibuprofen and you were good to go, and this just feels different. That's not a coincidence. It's biology. Yes, biology working for us as we live longer. Actually, it's why we have to know about our body's biology, because we do live longer, and way back in the day, we didn't. We would get to menopausal age and that would be it for the human woman. But now, luckily, we get to keep going. So let's figure out how we're going to function within this awesome life that we are given. That's supposed to sound good, but I can hear the sarcasm coming out of my voice. All right, so the biology of estrogen. I was trying to research, this is super geeky. I do this so you don't have to. I was trying to research exactly how many functions in our body that estrogen has. And thank you, science, they haven't been able to exactly pin that down yet. If you didn't know, women's health research is far behind and underfunded and much less sufficient than it needs to be, especially as we go through the perimenopausal years and into postmenopause. But there are estimates anywhere up to 400 functions is the current thought. And that's a lot of functions in each of our bodies. So it will probably not surprise you to see this slide and see that estrogen plays a role in regulating our inflammation, modulating our pain, tissue repair. So when we get an injury or cut, or when we work out super, super hard and try and break down those muscles a little bit to try to build them back stronger. And energy production. I don't know if any of you remember high school biology, but the mitochondria are the little powerhouse of the cell, and they make the energy. And yep, there's a role for estrogen in those mitochondria, which is super. And what I mean by role for estrogen in these things, it means that all of these different parts of our body, the different cells, have estrogen receptors. So the hormone estrogen has a specific place that it goes in the tissues and on our cells, that it fits in like almost like a key into a lock. That receptor is like the lock and the estrogen is like the key. And when we don't have estrogen at the same levels, or when we are getting a drop, like a sudden drop in our estrogen because it's uneven during perimenopause, all of these different body tissues are affected. Like I was saying on the previous slide, estrogen fluctuates in early perimenopause, so we'll have spikes and crashes. It doesn't just kind of smoothly decrease, it is all over. And that causes our baseline inflammation, so just the amount of inflammation in our body at any given moment, to rise. What does that do, you ask? Well, my friends, that affects our joints and muscles with pain and stiffness. It affects our connective tissue, and that connective tissue is all over, and that also has stiffness. And it affects our little mitochondria, the cellular energy powerhouses. It's not just oh shoot, my knees are sore today. This is your whole body, your whole system with having some extra inflammation than it was used to. This is the cascade, which I mean by that is the snowball. If we have pain, more inflammation leads to more pain. More pain can disrupt our sleep, which is already tough in perimenopause. The fragmented sleep increases the inflammation even more. And then that higher inflammation worsens pain and fatigue. So it is a vicious downward spiral if you don't do anything to help support yourself. Your day-to-day recovery, like you just can't keep up. Your body can't keep up with the inflammation. All right, we need a reframe. This is not weakness. It is not us being just too sensitive. It's not, oh, it's just aging and that's how it is. No, this is inflammatory response, our whole entire body, and it's inflammatory response that coincides with a hormonal transition, as well as our stress load, which is most likely too high. I would say 99.99% of us women in midlife have a stress load that is too high, and insufficient recovery. We're not allowing the life support things we need to recover from this inflammation, and so it just keeps getting worse. It just keeps getting worse. Your body is overwhelmed by this hormonal change combined with the inflammatory response. All right, lovely friend. So, what actually helps? If you've watched any of these videos, you are probably getting really good at knowing what these are. Have you tried some of these things yet? So, what helps is not pushing harder, is not the go, go, go in our society, is not the just get through this week bullshit. That is bullshit. That does not help your body. You need to lower the inflammatory load and improve your recovery. You allow a little more ease into your body so that it can recover better. Sleep protection, you've heard it here multiple times. Any amount of sleep that you can improve is going to reduce inflammation and improve pain. Any amount. So slowing down a little bit sooner at night, stopping the doom scrolling, stopping the the blue light from your phone. If you drink alcohol in the evening, drink it a little bit earlier. Take what you will from that. But if you drink it a little bit earlier, it metabolizes through your bloodstream and through your body. And by the time you're supposed to hit that good REM sleep later in the night, you won't be impacted by that alcohol. Gentle movement, slow, steady walking, maybe walking if you have a little dog. That's what I do. I take my little dog out for slow walks. Easy, gentle strength training in the evening, like really gentle, like a 1-pounder or something, just stretching with light weights. Stretching, yoga, tai chi, gentle movement improves the joint lubrication. So there's synovial fluid in your joints that allows them to move without pain. It's like helps the cushion in your joints. And when you move gently, that synovial fluid can be better distributed in your joints. So it doesn't hurt so much to move those joints. Week to week, strength training a couple of times is very protective for our joints, tendons, and connective tissue. It makes all of those tissues stronger and able to just hold themselves in place better. That's super helpful. Stress reduction. I have to remind myself all the time, we have to reduce our stress. No one else will do it for us. No one is going to come to you and say, oh, honey, you seem so stressed. What can I take off your plate for you? We have to do it. It's part of our grown-up lady boundaries. the cortisol, the stress hormone, will directly impact increased inflammation, and that directly impacts your joints and your pain. Nutrition, supportive nutrition. I will never tell you not to eat anything, just eat things in a balanced way. So if you're going to have a lot of carbs, balance it out with some protein and some healthy fats. Those are nuts, olive oil, avocado oil, avocados, things like that. So, because if you have unstable blood sugar, if your blood sugar is also spiking and crashing along with your estrogen, just makes inflammation that much worse. Okay? Symptom by symptom fixes don't really work. We are one system. As much as medical specialties want to break things apart and treat us like we're separate systems, we're not. We're all one. So if you help yourself by better sleep, it's going to help everything. If you hurt yourself by going and eating an entire giant movie popcorn all at once, that's going to make you feel worse all over.